Thank you. Bonjour à tous.
Good morning, everyone.
Regional variation in COVID-19 disease indicators, including weekly case counts and laboratory test positivity. Nevertheless, SARS-CoV-2 virus transmission continues across the country, including with increased growth of emerging Omicron variants, BQ.1.1 and BF7. At the same time, other respiratory viruses, including respiratory syncytial virus, or RSV, and influenza, have increased above seasonal levels as respiratory virus season gets underway early in Canada. At the national level, RSV activity began to increase several weeks ago, with laboratory test positivity above expected levels for this time of the year. More recently, influenza activity increased steeply and has already crossed the seasonal threshold of 5% lab test positivity. These surveillance indicators point to the need for stepped up precautions as SARS-CoV-2, influenza, and other seasonal respiratory viruses could continue to co-circulate in the weeks ahead. We are likely all aware that there are reports of heavy strain on emergency departments in many parts of the country. This includes children's hospitals, where RSV-related admissions have been very high. In addition, over half of recent influenza detections have been in children and teenagers. Although public health measures, including our individual prevention practices, kept COVID-19 and seasonal respiratory viruses at bay for the past 2+ years, this third winter of COVID-19 comes with some cautions. Firstly, with the relaxing of population public health measures and a return to in-person learning, work, and social activities, our contact rates have increased. This means more opportunities for exposure to COVID-19, as well as other seasonal respiratory viruses. In addition, although Canadians achieved among the world's highest coverage for a primary series of COVID-19 vaccines, many are beyond a 6-month time lapse since the last COVID vaccine dose or Omicron infection, so immunity is falling, leaving us all less protected against severe disease. Last but not least, immunity to other respiratory viruses is lower given less circulation of these viruses over the past 2 winters, as well as the need to update influenza vaccine protection. So what do we need to do about these concerns? I know we're all tired and we know only too well the long list of good habits that can help keep us and others healthier. So let's focus in on the top 3 recommendations. First, boost your immunity. If it has been 6 months since your last COVID-19 vaccine dose or booster, get vaccinated with a bivalent Omicron targeting booster. It is also a good time to get your flu shot. Secondly, protect your respiratory tract from invading viruses. Keep up with the hand washing, wearing good quality, well-fitted face masks when indoors, especially if you can't avoid being in crowded or poorly ventilated spaces. And lastly, reduce spread to others. If you have symptoms, please stay at home. This helps protect us all, including those at high risk of severe respiratory illness, such as those who are immunocompromised, as well as young infants, young children, pregnant people, and older adults. Protecting those who are at highest risk and can't be vaccinated or don't mount a strong protection is also key to protecting health system capacity for us all. To meet the challenges of this fall and winter, let's recommit to not lose the gains we've made as we resume in-person activities. Although no individual layer of protection is perfect, when used consistently and together, vaccine plus layers can provide excellent protection against COVID-19, as well as other infectious diseases we may encounter. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. Il y a actuellement des différences d'une région à l'autre en ce qui concerne les indicateurs relatifs à la COVID-19, notamment le nombre hebdomadaire de cas et le pourcentage de positivité aux tests de laboratoire. Cependant, la SARS-CoV-2 continue de se transmettre dans l'ensemble du pays et l'on observe un taux de croissance accru de nouveaux variants d'Omicron, tels que BQ1 et BF1.1 et BF7. On constate aussi en cette période que d'autres virus, comme le virus respiratoire syncytial ou VRS et la grippe, ont dépassé les niveaux attendus à ce moment-ci de l'année, ce qui indique un début de saison hâtif pour les virus respiratoires au Canada. À l'échelle nationale, la croissance de l'activité de RSV a débuté il y a plusieurs semaines et le taux de positivité au test de laboratoire est supérieur au niveau attendu à ce moment-ci de l'année. Plus récemment, l'activité de la grippe a connu une croissance marquée et le seuil saisonnier de 5 de positivité au test de laboratoire est déjà franchi. La situation de ces indicateurs met en évidence la nécessité de multiplier les précautions dans la mesure où le SARS-CoV-2, la grippe et d'autres virus respiratoires saisonniers pourraient continuer de circuler simultanément au cours des prochaines semaines. Chacun a probablement entendu parler de la situation dans les urgences de nombreux endroits au pays qui sont soumis à de lourdes pressions. Cette situation touche aussi les hôpitaux pour enfants où les admissions causées par le VRS sont depuis quelque temps très élevées. De plus, près de la moitié des récentes détections de cas de grippe touchent des enfants et des adolescents. Bien que les mesures de santé publique, y compris les pratiques de prévention individuelles, aient dans une certaine mesure tenu en échec la COVID-19 et les virus respiratoires saisonniers pendant plus de 2 ans, quelques éléments appellent la prudence à l'approche du troisième hiver en présence de la COVID-19. D'abord, étant donné l'assouplissement des mesures de santé publique et le retour à l'enseignement, au travail et aux activités sociales en personne, les taux de contact ont augmenté. Cela suppose des risques plus nombreux d'exposition à la COVID-19 ainsi qu'à d'autres virus respiratoires saisonniers. Ensuite, même si la population canadienne est parmi celles qui comptent le plus grand nombre de personnes ayant reçu une série primaire de vaccins contre la COVID-19 dans le monde, bon nombre de ces personnes ont reçu leur dernière dose ou été infectées par Omicron il y a plus de 6 mois. L'immunité est donc en baisse et nous nous en trouvons tous moins bien protégés contre les conséquences graves des maladies. Enfin, un point tout aussi important, l'immunité aux autres virus respiratoires s'est affaiblie compte tenu de la circulation moindre de ce virus au cours des 2 derniers hivers et de la nécessité pour chacun de renouveler sa protection vaccinale contre la grippe. La question se pose donc de savoir comment réagir à ces sources de préoccupation. Il y a évidemment une lassitude généralisée et tout le monde ne connaît que trop bien la longue liste des bonnes habitudes à maintenir pour que chacun demeure en bonne santé. Je m'en tiendrai donc à 3 recommandations qui semblent primordiales. Premièrement, augmentez votre immunité. Si votre dernière dose de vaccin de rappel ou de la série primaire remonte à plus de 6 mois, allez vous faire vacciner à nouveau contre la COVID-19. La dose de rappel que vous recevrez sera bivalente et visera Omicron. C'est aussi le moment de recevoir votre vaccin contre la grippe. Deuxièmement, protégez vos voies respiratoires contre les virus envahisseurs. Continuez de vous laver les mains et à l'intérieur, portez un masque de bonne qualité, bien ajusté, en particulier dans les lieux bondés ou mal ventilés si vous ne pouvez pas les éviter. Et troisièmement, évitez de transmettre les virus à d'autres. Si vous avez des symptômes, je vous en prie, restez à la maison. Cela contribue à nous protéger tous, y compris les personnes qui, si elles contractent un virus respiratoire, risquent fort d'être gravement malades, comme les personnes immunodéprimées, ainsi que les bébés, les jeunes enfants, les personnes enceintes et les adultes âgés. Protéger les personnes qui présentent un risque élevé et ne peuvent pas se faire vacciner ou n'acquièrent pas une bonne immunité est aussi une façon de protéger les capacités du système de santé pour le bien de tous. Afin de relever les défis de l'automne et de l'hiver, maintenant que les activités en personne ont repris, engageons-nous tous ensemble à ne pas perdre les acquis. Bien qu'aucune couche de protection ne soit parfaite, lorsqu'on les combine de façon constante, les vaccins et les couches de protection offrent d'excellentes défenses contre la COVID-19 et les nombreuses autres maladies infectieuses auxquelles on peut être exposé. Merci. Thank you. Miigwech.
Okay, we'll now move to questions. We have till about 10:45-ish. We will start with Cassandra Sklarski from the Canadian Press. If anyone else needs to ask or wants to ask a question, please raise your hand. I don't see any other hands raised at the moment. Go ahead, Cassandra.
Hello, good morning. Can you hear me?
Good morning. Yes, we can. Go ahead, Cassandra.
Great. Well, we're seeing pediatric centers, doctors saying that they're overwhelmed by very young, ill patients. And it seems to have only been made worse by parents who can't find pain and fever relief on store shelves. So I understand that hospitals will see more supply soon, but when will Canadians have access to more products?
Thank you for that question. Of course, from the Public Health Agency, we're not directly involved in the supply front, but I do know that our Health Canada colleagues are working extremely hard with different partners, including manufacturers, and that they've also enabled the importation of supplies such as ibuprofen from the United States and acetaminophen from Australia. So I think they're working as hard as they can to, with the understanding that, of course, parents and kids need these medications. But we are happy to have you follow up with our Health Canada colleagues.
All right. Can I have a follow-up to that question?
Yeah, go ahead.
Okay, because I'm wondering to what degree, like we're obviously seeing, this crisis in healthcare, and then the COVID vaccine uptake as well, with children under 5 remaining quite low. With all of these things together, like to what degree is this all contributing to the crisis in the healthcare system? But I'm also trying to parse out, I guess, the very low vaccine uptake with the under 5s, with the 3 viruses that you mentioned that are circulating much higher now than we've seen otherwise.
Yes, so the vaccine uptake for the youngest children has remained relatively low. I think it's at about 6.5%. And so that can certainly be improved. And that we need to provide parents and certainly healthcare providers that they engage with the necessary information so that they can make that choice to get children vaccinated, but most importantly for kids with underlying medical conditions as well. But what we're seeing, I think, at the moment is a confluence of different viruses that are circulating at the same time. And that is what's impacting pediatric hospitals. So I think Canadians are just learning about a virus that we've known for a very long time that affects children every year, the RSV virus. So that's been the virus that's taking a big hit in terms of pressures on the hospital system. So and there are other viruses, of course. Influenza is really just beginning to make a steep increase. So while it may not have been the predominant virus that's impacting children, we're definitely seeing that happening right now. So getting influenza vaccine is something else that parents and indeed anyone over the age of 6 months can do. And you can actually, for anyone over the age of 5, can get a simultaneous co-administration of influenza and the COVID shot. So all of these layers, and including all the ones that we keep repeating about, can help maybe dampen the surge to those hospital systems. And I think that's what public health can do to help, and everybody can play the role. And so at the same time, of course, we recognize that our hospitals are working really, really hard. And many people are working hard to try and make sure supplies and other important priorities are being addressed.
Thank you, Dr. Tam. I will move to Michelle Saba, La Presse Canadienne. Go ahead, Michelle.
Oui, bonjour à vous deux. D'abord, assisterons-nous à un retour en force de la COVID-19 au cours des prochains mois? À quoi doit-on s'attendre en termes d'intensité de la transmission du virus pour les prochains mois?
Oui, merci pour la question. C'est Dr. Njoo. On n'a pas une boule de cristal, mais avec qu'est-ce qu'on voit actuellement, la situation est peu stable, mais on voit aussi que la situation est dynamique. Hein, on attend peut-être une augmentation de cas de la COVID-19, mais comme on l'a dit aussi avec nos notes d'allocation et aussi la saison de maladies infectieuses respiratoires en général. Donc, c'est pas seulement une question de la COVID-19, mais aussi avec la grippe, avec pour les enfants, avec le virus, le VRS. C'est vraiment une question pour nous autres. Comment on peut garder la capacité de le système de soins de santé parce qu'on ne va pas déborder, pas seulement avec les cas de la COVID-19, mais avec les autres maladies infectieuses respiratoires. Donc, je pense que c'est très important de souligner encore le point qu'avec tout le monde, peut-être toujours garder leur vaccination à jour et aussi utiliser constamment d'une bonne façon toutes les autres couches de protection, le masque, ajusté dans les espaces à l'intérieur, bondés avec beaucoup d'autres personnes ensemble. C'est aussi la ventilation. Il y a toujours les mêmes messages, on a souligné plusieurs fois, mais je pense que c'est important parce que on voit avec les virus, c'est la saison est active avec le début, avec tous les virus. C'est sûr, peut-être on peut avoir un hiver très, très dur pour toute une gamme des virus respiratoires.
D'accord, parfait. Et ma deuxième question, c'est un 2 pour 1. D'abord, j'aimerais savoir quelle proportion de la population est adéquatement vaccinée en ce moment. Puis d'autre part, vous savez, il y a beaucoup de gens qui semblent être passés à autre chose que la COVID-19. Croyez-vous que la fatigue pandémique, est-ce que vous la craignez, cette fatigue pandémique, d'autant plus que l'immunité est, de ce qu'on comprend, en baisse?
Wow, c'est une bonne question. Avec la couverture vaccinale, c'est quelque chose que c'est toujours une question de garder peut-être d'une semaine à l'autre. Je pense que si on parle des séries primaires, la série primaire, les deux doses initiales, c'est pas mal. La population canadienne, presque 90%, c'est plus de 80%, c'est sûr. Et je pense que si on regarde aussi les groupes d'âge, c'est sûr que les personnes plus âgées sont très bons pour ont reçu leur série primaire. Si on parle des troisième, quatrième doses, des doses de rappel, la situation, peut-être les nouvelles ne sont pas si bonnes et c'est peut-être 60% peut-être en général. C'est difficile parce que ça dépend aussi des groupes d'âge, mais je pense en général, tout le monde au Canada, tous les Canadiens et les Canadiennes ont peut-être un travail à faire. Il faut vraiment réfléchir. On souligne le message. Hey, est-ce que ça fait déjà au moins 6 mois depuis la dernière dose, n'importe quelle dose, et est-ce que c'est aussi 6 mois peut-être après une infection? Si c'est déjà 6 mois, c'est le temps de recevoir une dose de rappel. Et maintenant, c'est vraiment le vaccin bivalent. C'est le vaccin qui contient la souche originale, mais aussi la souche d'Omicron. Donc, je pense que pour l'hiver, c'est une bonne protection. Et en même temps, c'est toujours important aussi de recevoir aussi le vaccin antigrippal. Et aussi, la deuxième question pour la fatigue.
Oui.
Oui, je pense que c'est normal. Tout le monde est tanné. Ça fait déjà 2 ans et demi. Et on voit parce que tout le monde veut, comment dire, recommencer avec les activités sociales, aussi prendre des vacances, voyager, retourner au travail, aussi aux écoles. C'est important pour notre société. Mais je pense qu'il faut trouver un équilibre. Je pense on sait c'est quoi les bonnes habitudes et je pense que on peut avoir tous peut-être aussi continuer à peut-être avoir plus des activités sociales, mais je pense que c'est très important pour tout le monde, être prudent si on veut faire quelque chose avec les autres. peut-être s'il y a des personnes peut-être plus à risque, immunodéprimées, tout ça, c'est très important. Peut-être, c'est pas seulement une question de se protéger, mais aussi penser à protéger les autres. C'est pourquoi on souligne le point, c'est très important. Peut-être il n'y a pas une exigence, mais le port de masque, une bonne masque bien ajustée, c'est très important si on est à l'intérieur avec les autres pendant l'hiver, et aussi garder à date votre vaccination.
Merci.
Okay, our next question will go to Zhaoli Li. If you can state your media outlet before you ask your question, please.
Hi, yes, can you hear me all right?
Yes.
Yeah, this is Zhaoli Li from City News in Ottawa. I just wanted to ask, how is this season going to compare to earlier COVID winters? We saw a decline in seasonal flu and cold during earlier waves, if I recall, I imagine due to things like masking and social distancing. So with everyone taking that less seriously this season and this concurrent increase in flu, RSV, and COVID, how will this winter compare?
Yes, this is Theresa Tam. I'll answer that question. So we are already seeing the difference with this fall and winter season compared to the last 2 years. Of course, pre-pandemic, respiratory viruses do come around every year, including influenza and RSV. The pressure on the health system right now is because these viruses may be synchronized in terms of the timing, and that's what's pushing the pressure on the health system as well. So not only has the COVID-19 not done with us, even though we're fatigued, we're seeing the influenza really rising quite steeply right now. It's going to be different in different parts of the country, but in general, that's just beginning to climb. And then RSV that began a little while ago is still at a very high level. So that's quite different from the last couple of winters. And that's what's putting the pressure on some of the pediatric hospitals. As to how the rest of the winter will unfold, we're just going to have to watch it really carefully. And of course, we will provide updates as needed to people, and certainly at the local level. I know medical officers of health are trying to keep the population appraised of these activities, but we do know that during a winter period, we are going to get respiratory virus circulation, and that's why we're advocating for people to make sure they enhance those good personal habits.
It's Dr. Njoo. Maybe I just underline an additional point to what Dr. Tam has said, and that's the fact that the future is not predetermined. In many ways, we're in control of our own destiny. So how sort of serious the upcoming, or sort of already starting at the beginning of the respiratory virus season. If people keep up to date with the COVID-19 vaccination, get their flu shot, and use, in a consistent manner, all of the good sort of personal protective measures, not just for themselves, but to protect others. The consistent use of masks, especially in indoor spaces, are not well ventilated. Be thoughtful about who they interact with and so on. Then I think we might have a less serious season than maybe if people really, as they say, let go and don't sort of take it seriously and don't get their vaccination up to date and so on and so forth. So I think, it's not that it's going to necessarily be as bad just because we're going to say, well, that's the way it is. I think we can control that. So I think it's up to everyone to, as they say, do their part. Thank you.
And as a follow-up, Dr. Tam, during your prepared remarks, you mentioned that influenza and RSV lab test positivity levels were beyond what's expected seasonally. Do you have any additional detail, context, or specific numbers on how much beyond seasonal levels those numbers are?
Mm-hmm. Well, I think one is the timing. So it's a relatively early acceleration compared to previous years, certainly for RSV. So the timing is earlier, and it's within some of the usual, for influenza, we're just beginning, as I said, to see that steep increase. So it's just passing what we call the seasonal threshold for, beginning to be quite certain that the influenza epidemic is underway. So we're just at the beginning of that. There are some information on our website as well. There's Flu Watch, which is easier if you see that curve going up. It's quite steep, but it's just at the beginning. So it's not that high, but it's accelerating. For RSV, it is above seasonal levels. And we had different indicators to mainly from a laboratory detection perspective. And so I think depending on what happens next, those could be very sharp peaks that go up and come down, or they could be less sharp but more prolonged. We don't know that yet. So you can. There's a number of different indicators that you will be able to see on our website.
Okay, thank you. We'll go to Olivier Ferrand-Poisé from TVA.
Oui, bonjour. J'aimerais poser une question sur une autre pénurie, celle d'amoxyl, qui semble être l'antibiotique beaucoup utilisé chez les enfants. Est-ce que c'est quelque chose qui vous inquiète? Puis qu'est-ce qui nous attend à ce chapitre-là?
Oui, merci pour la question. C'est Dr. Njoo. Oui, c'est quelque chose. On suit étroitement c'est quoi la situation. C'est nos collègues à Santé Canada qui gèrent la situation. On sait que le personnel de Santé Canada, l'équipe travaille très fort, continue de travailler avec les fabricants déjà pour assurer qu'on a assez d'approvisionnement de l'antibiotique amoxyl ici au pays. Moi, je comprends qu'il y a peut-être en total une douzaine, je pense, de fabricants et peut-être des pénuries, c'est peut-être avec quelques-uns des fabricants, mais pour l'instant, je pense que c'est aussi très important si un enfant ou n'importe qui est malade, de vraiment voir un médecin parce que les antibiotiques, on sait, c'est vraiment pour gérer les infections causées par les bactéries. Ici, on parle de la COVID-19, le virus, le VRS, tout ça, ce sont les virus et les antibiotiques ne marchent pas contre les virus, seulement contre les bactéries. Donc, c'est très important d'utiliser les antibiotiques comme il faut. Merci.
Peut-être juste un petit suivi. Je sais que vous en avez parlé. Vous dites que vous n'avez pas de boule de cristal, mais je sais qu'on prédisait une vague début décembre. Avec ce qu'on voit en ce moment, vous parliez d'un début de saison hâtif pour les virus respiratoires. Est-ce que c'est encore dans les cartons ou ça va être plus tôt? Bref, est-ce qu'on a une idée d'un certain pic de ce cocktail de virus en ce moment?
Oui, oui, c'est sûr, on n'a pas une boule de cristal, mais si on voit qu'est-ce qui se passe normalement dans une saison, par exemple, je prends l'exemple de le virus VRS. Normalement, le pic comme la coupe épidémique parmi les enfants, et même les adolescents, tout ça, c'est vers la fin du mois de décembre, aussi début du mois de janvier. Donc, comme on a dit, on est juste au début de la saison, si on parle d'une saison normale, régulière, et c'est possible. On va avoir des semaines plus dures jusqu'au pic, et normalement, c'est pour beaucoup de maladies infectieuses respiratoires, c'est plus vers la fin du mois de décembre, janvier. Aussi, peut-être que c'est aussi lié avec les fêtes et le fait que beaucoup plus de personnes vont rassembler encore à l'intérieur avec les amis, la famille, tout ça. Donc, je pense que c'est encore le message, il faut être prudent. C'est toujours important d'utiliser toutes les couches de protection et garder à jour la vaccination.
Merci.
Thank you. I think our next question is from Cormac McSweeney from Citi.
Hello. I just wanted to ask a couple of questions that I think were kind of addressed in French already. But first off, on masks, we have some medical professionals and heads of hospitals who are saying we need to bring back the mask mandates. Is that something that the federal government is in favor of? And are you having any conversations at all right now with your provincial colleagues about potentially bringing back mask mandates?
I mean, we have very regular contact with other chief medical officers, and they will share their experiences and looking at different ways that they're managing within the provincial and regional context. So, I mean, from our perspective, we, of course, like as usual, we recommend using masks as a layer of protection. But it's up to the provincial authorities to decide what they might do in their own context. But we know is a layer of protection that can reduce risk. It's not perfect like all other layers, but if it's added to the other layers of protection, including vaccination, then it might actually make a difference in terms of dampening the surge so that the hospitals can cope just a little bit better.
Thanks. And speaking of hospitals, you know, we've had a lot of children's hospitals in Ontario talking about being overwhelmed with patients at the moment. I'm wondering if you can give us some perspective, and I think this was discussed a little bit earlier, but on the shortage of children's Tylenol, Advil, those medications, plus the struggle of some people in some regions from getting things like amoxicillin at the pharmacy. And I ask this as I have two sick kids behind me right now, but how much is that playing a factor in the overwhelming of hospitals when, let's say a fever that could have been managed by regular pain medication could have avoided a potential trip to the hospital, let's say?
Yes, so, and I can hear your kids. I hope they feel better soon. So as we just been discussing, there are a number of viruses which are circulating that's putting pressure on pediatric hospitals. And I know that Health Canada, that's my colleagues who are on the front lines of trying to collaborate with manufacturers and the Canadian Pediatric Society and the Canadian Pharmacists Association to make sure that they are tapping into every avenue to look at what they could support in terms of the supply, including importation from other countries. At the same time as I know that the Canadian Pediatric Society, for example, has information on how parents can make their children more comfortable when they have a fever. The fever itself is just a manifestation, of course, of the infection and is part of how your body is fighting the virus as well. But kids get very uncomfortable with the fever, and there are other ways to help them be more comfortable and try and bring the fever down as well. So that kind of information is really important. And also other ways of pain management. But that, of course, doesn't solve the issue of parents needing some of these medications. And I do know that, as I said, the Health Canada team is working really hard at this. The demand has been very high for a number of reasons, including the return of some of these seasonal viruses. On the amoxicillin, it's the same. And as Dr. Njoo has said, these antibiotics are important for some of the common bacterial infections that might also be increasing at this time. Of course, these antibiotics are not effective for viruses, but we know that there's a need, and Health Canada is working with, I think Dr. Njoo mentioned that there are 12 companies in Canada, and they're working with them all and looking at different ways that pharmacists can manage supply. And some of it is very patchy in terms of distribution. So you may be in an area of Canada that has no issues and other areas of Canada that may be experiencing that shortage. So some of the management may involve making sure that there's some equitable distribution of inventories. And with that, there could be some intermittent impact on supplies as well.
Thank you. I think we have a question from Amina Zafar from CBC. you there? Okay, I don't hear anything. We'll come back to you in a minute. Cassandra Sklarski from Canadian Press, I think, has another question.
Yes, hello. I was hoping we can return to the under 5 vaccine rates again. I'm just wondering about what can be done to boost those numbers. Is there anything public health should be doing to increase update? Is there something about the strategy, that the messaging that just isn't getting through?
Dr. Tam, you're on mute.
Sorry about that. Yeah, so in increasing vaccine uptake in the younger children, I think making sure parents understand that while, of course, the observation is that children, or some of the younger children, don't have a severe an outcome from COVID-19. But at the same time, when there's lots and lots of infections, that can still result in much larger number of children then getting seriously sick enough to get hospitalized, or some of them, a few of them, luckily not that high, can get even more seriously sick than that. But I think there's been a campaign that we're trying to provide to try and answer questions from parents, because there may be a lot of misconceptions about the vaccine, despite the fact that we know that the safety of the vaccines have been monitored through millions of doses provided to older age groups, including adolescents, and there's no significant safety signals, and the benefit outweighs the risk. There's still questions from parents. So there's a campaign called Lots of Questions that's been running to try and answer those questions. And we've been trying to make sure the healthcare providers, like pediatricians and others, have the information that they need to answer the questions from parents as well. But I think the emphasis is on children who have underlying medical conditions, to make sure that they are well protected and they immunocompromised. And I think making sure access is available, et cetera, and making sure that children made to have as good an experience as possible during the vaccination experience is also important. So I think lots is taking place in different levels of the public health system. But I think, right now is quite a critical moment for pediatric hospitals. So I think if parents can try and get themselves, their knowledge levels increase and their answers questions, and that would be great. And if they can then get their kids vaccinated. I think another reason might be the fact that, of course, a lot of kids actually got COVID, and there's recommendations to wait at least 3 months, but the interval is 6 months potentially to get boosters, and you can start your primary series after you've waited a couple of months if you haven't started that yet. Because what we know is that even if you got infected, an infection plus vaccination can give you some of the strongest immunity in terms of the hybrid immunity, which might be an important consideration for parents as well.
Okay, thank you. Well, we'll try again. Amina, are you able to speak yet? Okay, I guess not. I see a question from JP Tasker from CBC.
Hi, Mia, can you hear me?
Yes.
Okay, so Amina sent me her question, so I will just ask them for her. How about that?
Wonderful.
So her questions are about masking, doctors. She wants to know if, you kind of touched on this with Cormac's question, but is there more that you think the provincial public health authorities should be doing to encourage Canadians to wear masks indoors?
I think all of our colleagues are messaging, what the layering on the protection, including wearing a mask in crowded places that are, particularly if they're poorly ventilated, that should sort of go hand in hand into doing whatever one can to improve ventilation as well. So I think the provincial and local authorities will look at what's happening in their own communities and make their own decisions. That's basically what's happening across the country right now.
And then there was some suggestion from some groups that maybe one option is to offer, free masks in schools, for example, or other indoor spaces like what, similar to what we've done with COVID tests, having those available at pharmacies. Do you think that would be a viable solution, offering free masks in more places? Would that encourage people to wear a mask?
Well, I think it's an interesting and important consideration, and if it depends on what the reasons are for people maybe not wearing a mask at this point, and some of it might be the fatigue factor. But I think if people know that there's the surge in the virus is happening now, they may then choose to increase the level of protection. But yeah, there may be differential access to masks, and that could be something that could be examined and see if it would make any difference. I don't think that I haven't heard of any supply issues with masks that can be made and respirators that can be made available. So that is a consideration that people can take.
Can I just squeeze in one last my own question here?
Sure, go ahead, JP.
Is it safe to say that it is really flu and RSV that is driving the surge in hospital capacity and not COVID, or is it just a toxic combination of all three?
I think it's a combination, I think, of all of the above. But COVID-19, its trajectory so far has been that what we think is that with, of course, everybody getting back together and increasing time indoors, there has been a resurgence. That resurgence, it's all different in different parts of the country as well. So you have to look at your local activities. That resurgence appears to have peaked, and we may have just passed the peak of that latest upsurge in the COVID-19 activities. However, there are variants afoot, these subvariants with increased growth waves. And so that's why I think Dr. Njoo indicated that it's not absolutely certain that downward trajectory would continue. So we'll see. So COVID is, peaking and may have plateaued and may be coming down in certain areas of the country. RSV had made an early start and is increasing and still at a high level. Influenza is just beginning and just accelerating. So there's a dynamic interplay with these viruses, and we actually don't fully understand these dynamics when they are occurring together, but they are occurring at slightly different times. Right at this moment in time, though, if you slice, the curves down this moment in time, all three plus other viruses are contributing, I think, is how to put it, and maybe just in different in terms of proportion, but RSV is definitely a big impact for the pediatric population.
Thank you. It is 10:45. We have one more question. Is it possible for you to stay to take that one question? Okay,
yes.
Great. Omar Mosley, if you have a question, please go ahead.
Hi, yes, thanks for taking our questions. My question is about rapid tests. And I'm not sure what role the Public Health Agency of Canada or Health Canada has in terms of working with the manufacturers and their instructions. But I spoke with an epidemiologist earlier this week who identified what he saw as a problem, saying people really need to be swabbing their throat because with the subvariants of Omicron, there's evidence showing that it grows faster in the throat than in the nose. And he's saying, people are just swabbing their nose and, getting a negative test and saying, I'm fine. So I'm wondering if there's any consideration, if Public Health Agency of Canada or Health Canada plays a role in this, to issue updated guidelines to ensure that Canadians are getting the most accurate results from their tests?
Yeah, thank you for this question. This question actually came up quite a while back, and I guess it's making a comeback. So there are different kinds of rapid tests on the market and all being made available across Canada. So it may depend on the rapid test that you're using as well, and they also have different swabs. And so it's not as straightforward as, any rapid test that you have your hands on. You can use different techniques, but what you're mentioning is that in some studies using certain types of rapid tests with the Omicron virus, swabbing both the throat and the up the nose can potentially have a higher yield. But that may not be the same for every single test. So I do think that you should still follow the instructions that are provided on the test packaging. What Health Canada's role would be to examine ongoing evidence. And if there is enough evidence, of course, that could shift in perhaps the labeling of how these tests could be administered. But there are a number of tests. I think a study was done actually in Nova Scotia in Canada, showing that based on the rapid test that they're using, swabbing the throat and the nose is together gives you a better yield.
Thank you. Omar, do you have a follow-up?
No, I'm okay. Thank you, though.
Wonderful. Okay, that will end today's press conference. Thank you, and everyone have a lovely day.
Thank you.
Thank you. Bye-bye.
Bye.